Assalamualaikum warahmatullahi wabarakatuh, and salam sejahtera to everyone who watched this video, and to Puan Nurul Huda binti Harun, teacher for Medical Imaging Technique and Image Evaluation 1. My name is Muhammad Alif Adaha bin Muhammad Zulkifli, and today I am going to present about AP ankle projection. First and foremost, this image is a true AP ankle proper positioning. Next, let's review the label structure of this image. On the superior side of this image, we can see there is distal tibia and distal fibula. On the middle side of this image, there is lateral malleolus, medial malleolus, and talus. On the inferior side of this image is the base of fifth metatarsal. On this video, we are going to evaluate this image using Paceman method. The first P is for projection. The required anatomy for a normal ankle AP, which is medial and lateral malleolus, talus, and proximal half of metatarsal, was demonstrated in the image. The next P is pathology. That is, the image shows no fracture or any abnormality. The last P is positioning. To have a true AP ankle projection, the patient must be positioned supine or seated on the table, and the leg must be extended. And align the leg and ankle parallel to the image receptor. And for true image projection, ensure there is no rotation, and the long axis of foot is vertical and parallel to the X-ray tube. This projection is a true AP and have no rotation. This can be proved by the open medial mortise joint and closed lateral mortise joint. There is also some superimposition of the distal fibula and the distal tibia. Next is A, which stand for alignment. First is X-ray tube and patient. The ankle is aligned to the X-ray tube. Second is X-ray tube and image receptor. The X-ray tube is perpendicular to the image receptor and directed to a point midway between malleoli. And the source image distance SID is 100 to 110 centimeter or 40 to 44 inches. Third is image receptor and patient. The ankle joint is aligned to the long axis of portion of the image receptor, or vertical or portrait. Next is collimation. The superior collimation of the image include the distal 1/3 of the tibia fibula, and the inferior collimation include proximal 1/2 of the metatarsal. Laterally, the image was collimated to lateral skin margin. Medially, all soft tissue was included in the image. Next, let's move to exposure. The exposure used is adequate for the penetration and radiographic contrast. The KVP exposure, which control the contrast, is adequate because we can see that bony cortical outline BCO of thin structure such as soft tissue and skin margin is visible on this image, and the bony cortical outline of thick structure is also visible. The thick structure, the BCO of thick structure is talus and tibia. The FAS exposure, which control the density, is also adequate because we can see the bony trabecular pattern BTP of thin structure such as soft tissue and margin is visible on the image, and the bony trabecular pattern BTP of thick structure such as talus and tibia is also visible on this image. The next part is M, which stands for marker. Marker is present and placed correctly. On this particular image, we can see there is a right marker visible on this image. Next is A, which stands for aesthetic. On this image, the aesthetic value, which is the image receptor, is placed vertically, portrait position, and the image receptor size used 10 times 12 inches or 24 times 30 centimeter, and the position the lower leg parallel with table. And the last aesthetic value is no artifact is present on this image. N is for name, no facility name, patient name, and examination time and date shown on this radiographic image in our study. Last but not least, suggestion or comment. Reprint with patient name and IC number, X-ray number, date, and place. Okay, this is the references that I use to complete this evaluation. If you want to research more about AP anchor projection, you can use these references. Reference, you can use all these references. And that's all from me. Hopefully, you get something from my video. Okay, thank you.